Okay, so remember, you have to tell them how you were coughing all night, and I think you need to ask for some antibiotics so you're not, like, wasting your time and money being here today.
Right, yeah.
Hey, may I come in?
Yeah.
And are you Alexis?
Uh-huh.
Pleasure to meet you. I'm Trevor. I'm here today to help you and get you feeling better if possible. Who's this you got with you?
I'm her friend Danae.
Pleasure to meet you. Thank you for coming too. So tell me, what brings you in?
I'm really sick. I've had a fever for 3 days, really runny nose, bad coughing at night, and my ears are really stuffed up.
Sorry to hear that. So 3 days of fever. The other symptoms, how long have those been going on?
Like 3 to 4 days. I don't know. I'm super miserable and I miss so much work. I think I need some antibiotics. Can you help me with that?
Oh yeah, well we definitely want to help you feel better. I do want to ask a few more questions and I want to do a physical exam and maybe run a few quick tests just to see which treatment options that we have available for you will help you the most. Okay, I'd like to test you for the flu, for strep throat, and for COVID-19. Does all that sound okay?
Yeah, that's fine.
Great. If you don't mind, let's have you sit on the table here and I want to just listen to your lungs and heart first. Just a few deep breaths for me.
As stated by the Centers for Disease Control and Prevention, or the CDC, upper respiratory infections, or URIs, are extremely common and are among the top 3 diagnoses in outpatient settings. URIs are usually caused by a virus, not bacteria, and at least 200 different viruses can be the cause. The common symptoms for colds or other URIs include sneezing, runny nose, sore throat, coughing, congestion, and possible fever. Symptoms can last for up to 2 weeks.
Hey, you two. Thanks for waiting so much. I appreciate your patience. But I do have some great news for you. Your tests for the flu, strep, and COVID-19, they all came back negative. And there's no signs of infection in your eyes, your ears. So what I think you're dealing with here is an upper respiratory infection. And infections, they can come in 2 varieties, bacterial and viral. And since your strep came back negative, most likely this is a viral infection, kind of like the common cold, and not a bacterial infection.
So does this mean you're not going to give her any antibiotics?
That's a great question. From the get-go of this visit, you mentioned antibiotics, but antibiotics actually only help fight bacteria, not viruses. And even though antibiotics are helpful for some infections, taking them when they're not needed is actually more dangerous for you.
Oh, okay. So I just want to feel better. Won't antibiotics help me feel better even though I have a virus?
Yeah, again, unfortunately, antibiotics won't actually help you feel any better with a virus and may even cause some unwanted side effects like diarrhea and rashes. Viruses just kind of have to run their course until your body builds up enough of an immune response to fight it.
According to the CDC, antibiotics do not work on viruses, such as colds and flus or runny noses, even if the mucus is thick, yellow, or green. The CDC estimates that 50 to 70% of all antibiotic prescriptions for URIs are erroneously given. This greatly impacts the rate of antibiotic resistance, which the World Health Organization lists as one of the top 10 global health threats today. Antibiotic resistance means that bacteria have developed resistance to the antibiotic being used. When this happens, the bacteria are much harder to kill, continue to spread, and even create more severe infections that our current antibiotics cannot fight.
Okay, so antibiotics won't help me feel better. I don't know, I came all the way here. Is there anything that'll help me feel better?
Oh, definitely. Yeah, I can share with you a couple strategies, treatment options that will actually help you feel better.
Some of the best treatments for colds and other URIs are not even medicinal, but simple treatments like resting, drinking lots of fluids, and using cough drops. Many over-the-counter medications can also help with symptom relief. Decongestants, NSAIDs, cough medications, and nasal sprays can help. If over-the-counter cough suppressants have failed to relieve symptoms, a prescription can be given for codeine cough syrup. But antibiotics should not be prescribed unless a secondary bacterial infection is suspected, or if trying to prevent a bacterial infection for those who are immunocompromised or have respiratory illnesses like asthma.
So unfortunately, some viruses, they can lead to secondary bacterial infections. So in 5 to 7 days, if you're not feeling any better, I want you to call the office and notify me of that. I'm going to give you my number here. So again, 5 to 7 days, you're not feeling any better, please give me a call.
So you're saying that if she's not feeling better, she's going to have to come back in and see you again and spend more time away from work and more money just to get this prescription?
Oh, that's a great question. In this practice, we have what we call delayed prescribing for antibiotics. What I can do is leave a note in your chart about the need for antibiotics. So if you're still feeling sick, call me, and what I can simply do is call your pharmacy over the phone, call in a prescription for that antibiotic, and you can go pick it up. Does that sound reasonable?
Yeah, thanks.
Wonderful. Any other questions? Concerns?
You have any?
No.
Awesome. Well, thanks for coming in. Let me show you how to get out of this place.